very warm good morning to one and all present here. I should appreciate that all of you are lucky to be here in Goa, the beautiful place in the whole of world, because Goa has been known all over the world as a tourist destination, and I'm sure that all of you must have been visited Goa before this summit. So, on behalf of Goa, I also welcome you. Right. I'm not from the banking sector, neither I'm from the IT sector. I'm from the administration section, so we at government level deliver so many services and facilities to the common man and people. So we have to interact with almost all level of people. Initially, I mean, you all know that we as government, we were regulators, more like regulators, but time has come, the things have changed, and now we are service provider to all of the citizens. The focus is that we should deliver to the citizens in the best possible way, the easiest possible way, and that is the reason why I think the banking institutions are key uh, stakeholders, we can say, for delivering whatever services or whatever schemes the government implements at various levels, made the central government level or made the state level. Basically, I'm from Goa and I have served here for last 20 years. And we have seen how people have now got the benefit of digital transformation. We had never expected that people would be getting services at their doorstep. And because of the digital transformation and the government initiatives, things have changed drastically. Uh, when I talked about the health sector, I mean, I've been posted as the Chief Executive Officer of the State Health Agency, Jammu and Kashmir, and I'm looking after the Pradhan Mantri Arogya Yojana. It is an insurance scheme wherein 5 lakhs rupees have been insurance cover for each of the families in JNK. In JNK, we have got around 25 lakhs families, and this scheme is being implemented for all of the citizens of JNK. The guidelines of the PMJAY says that it will be for the SEC families only, that is social and economical families. But in JNK, we have extended to the whole of JNK. That is, it is universal because we are moving towards the universal care for healthcare for citizens. When I talk about the initiatives of the state government, of the central government, what we expect is that people should get the best facilities. And this can be possible only through IT initiatives. I mean, years back, one would not imagine also that the passport what everyone holds, can be door delivered to the citizens in the nowadays. Earlier, there was a lot of queues. There was people used to go to the government departments and then apply for these things. But now the government mindset has changed. They are saying that people should be getting the facilities at their doorsteps. We have got a lot of social security schemes. We have got a lot of insurance schemes. We have got many schemes which are directly connected to the people. We all know that earlier times the budgets were made for the particular department, but that was never utilized at the end of the financial year. And the policies of the government was not going right to the people. But due to the digital transformation, I feel that direct benefits to the beneficiaries have improved the life of the citizens very much. And this is all because of the partnership with the state government, the IT sector, and of course the financial and the banking institutions. Because when we talk about the direct benefits to the beneficiaries or the citizens, the banking has very important role to play because they have their accounts with the banks, and unless the bank has been uh, have got connected with the schemes of the government, it is not going to possible. I feel that government wants to do much more and much more for the citizens, so that nowadays, I mean, you all of you knows, even the education, the other aspects, due to the COVID pandemic, we have learned many things, how digital transformation can help the common citizens and the people. In this regards, when I go back to my JNK state, I don't know how many of you have been visited to JNK. We have got this Darbar movement system over there because of the climatic conditions in JNK. Like 6 months, you will be sitting in Srinagar, and 6 months, the whole administration would shift to Jammu and Kashmir. And this was a big task for administrators to do that things, and lot of huge money has also been spent on that things. But now, because of the digital initiatives, we have initiated the e-office, and because of the e-office, there is no need for the whole administration to shift from one place to another place. This has saved the time, the money, and the manpower also. And in this regard, there are many initiatives which JNK has initiated. I mean, till 2016, we all know that how JNK was running. People were not been taken into confidence. The popular governments were running the government for their own selfish interest. I'm sorry. But now, being after the withdrawal of the Article 370, the government has been pushing and ensuring that lot of initiatives been, lot of new policies or new initiatives are being implemented, so that people get the benefit of the rest of the India what they were getting. The education, the health. In health sector, we have got Telemanas scheme, which gives the consultation from the doctor at the tertiary level, at the GMC or the schemes, and then it goes to the lower level, like uh, the primary health center or the community health center or the district hospitals. The doctors from these hospitals can have a consultation with the doctors at the tertiary hospitals, and then guide the patients at the grassroots level. And this is how we have been working on that things. There are many more initiatives. I mean, right now I have just joined just 7 months back, and I am looking after the Prime Minister Jana Arogya Yojana. The Jana Arogya Yojana is an insurance scheme, and we have seen that we have to interact with the, I mean, we have to work with the insurance company, and of course with the hospitals, who are the main stakeholders, and of course the citizens. Now, the payment gateway, I mean, what we are talking about today is that it is so easy that the payment to the insurance company, to the hospitals, because the hospitals are been scattered all over the state, and beneficiaries go and take the treatment. At the click of the button, the claims have been raised by the hospitals for whatever treatment they have given to the beneficiaries, and that has been verified, and then the payment is made to the hospital on the spot. Now, all those things, now it is so easy. Earlier, the hospital were not ready to come on platform to deliver under this particular scheme, but now they have understood that because of the system in place, all the private hospitals are now coming forward, and almost 95% of the private hospitals in JNK are running the Prime Minister Jana Arogya Yojana scheme in the JNK. So likewise, we all know that JAM is another portal where we are having government to business this, and all the payments of purchases through JAM are made directly through online, and this has saved lot of manpower as well as the working of the government, because once we know that it is been through the JAM, all the rates, all the procedures have been laid down, and we need to go by the required procedures, and everything is taken care. Otherwise, they used to come to the departments, then look after their papers. One paper is missing, second paper has been removed from the file, and then there was delaying tactics, and then corrupt practices was followed. But now, because of the digitalization of all these records and the schemes, the payment gateway has been opened for everyone, and every stakeholders are very happy for having business with the government and with the departments. With these few things, I would conclude my things. You have any Q&A, then you can ask me, because I will more focus on the Prime Minister Jana Arogya Yojana. Any queries on that, I will be more happy to answer those things. Means if you want to know like how the scheme runs, or how the banks been associated with these schemes, or how insurance companies been associated with these schemes, then I will be more happy to explain on those lines. Yeah, please.
With regards to insurance companies association with this, can you just elaborate more on that? How is that being done?
This scheme has been implemented in two modes. One is the insurance mode, and one is the trust mode. Okay, and so when we want to run this scheme through an insurance mode, then we go by an open tender. But then procedure what we followed is that we need to understand that there are number of packages. Package in the sense treatments which have to be given to the beneficiaries vis-a-vis the number of families to be covered under the scheme. So with that things, the insurance companies float their tenders, and we float the tenders, and they bid for that things, and they come into the picture. And the lowest one, L1, definitely in the government sector, we go for that thing. So we appoint the insurance company based on that things. But what happens is that when we select the insurance company, we have to check the parameters of so many health things, whether they have that human resource with them to verify the claims which are going to be raised by different hospital from across the state. So that is the main thing where we are saying that we are associated with so many insurance company. Earlier we were associated with the this Bajaj Alliance. Now we are associated with the IFCO Tokyo. So that is one. So it is for 1 year contract which we give it to them. So every 2 years, 1 year, it is renewing for 1 year. So 2 years, after 2 years, the new tenders have been floated, because the number of packages, the number of treatments increases, the number of hospital also increases. So there are many things which takes into consideration.
Thank you. And just a follow-up point on that, probably if you can elaborate, how do you see that effectiveness of this entire thing? How is it being effective on ground when it comes to the customer benefits?
Exactly. Yes, yeah. This is a very important question. If you see the scheme, this is the scheme which has been implemented by the National Health Authority. It is the web-based scheme. So everything is on the online. So once a person makes a card, he can directly go to any empanel hospitals, and with this card, he's been given the treatment. So once the treatment is given, the hospital will raise the claim on the portal itself. Then it has been verified by the doctors, and then it has been settled to the hospitals wherever the treatment is given. But then under this particular scheme, there was no mechanism where we can find out how best the service is given to the people, whether people are really benefited or happy with the scheme. So in JNK, what we have done is that we have started with the new initiatives. We have got an QR code scanner. This QR code scanner has been given to all the hospital wherever the hospital has been empaneled. So many individual or any patient who goes to any individual hospitals and take the treatments, after he's been discharged, at the time of discharge, he has been asked to scan that QR code and give his feedback. And that feedback comes directly to us, and we can know like whether the services given to the patients or the citizens is up to the mark or not. There are various parameters what we have asked the beneficiary to give the feedback, like whether there was how was the treatment at the time of arrival, whether they were given any hassle was there or any blockage was there for at the time of checking the card. Then what was the treatment given to them? How was the doctors have treated them? What was the nursing part of it? Whether there was an out-of-pocket expenditure, they were asked to get the medicine from outside the pharmacy, or other this thing, whether they were asked to go and do the diagnostics test, various diagnostic tests which are required to be undertaken, whether they were asked to do that. Because under the scheme, what is mandated is that everything has to be managed and arranged by the hospital themselves. Because of all these parameters only, they have been empaneled. Otherwise, they are not empaneled. So we ensure that the hospital has these basic facilities to ensure that whoever comes at their hospital, they are getting all these facilities like treatment, the medicines, the diagnosis also, all that things. So with this QR code, we are now getting to know what is the satisfaction the beneficiaries are getting. I'm happy to share here that with this initiative, what we have come to know is that 95% the people who have given the feedback were happy with the facilities, and 3% were not happy. And in those cases, there was a case of out-of-pocket expenditure. They were asked to go outside and buy the medicines. And in such cases, we go and inspect the hospitals and we penalize the hospital also. But I think that is a good thing that in the main scheme, it is not a part of it. But then we have taken that additional initiative so that people can give a feedback and we understand how it has been actually functioning at the in the field. Like, yes, please.
Yeah, Saurabh Datta from IDBI Bank. Just wanted to ask
So I work with Jammu Kashmir Bank very closely, and I understand that JKB Bank has, is most of the Kashmir, whole Jammu Kashmir, 95% bank with JKB Bank, right?
Yes.
So is there a way of that you could go ahead, because the payment is happening, everything is happening over there. You've tried to, incorporate and do some kind of relationship building so that it can all be consolidated together, because the payment and insurance and others can come all together.
Very true. I mean, you are right. The almost 95% is the share of the JNK Bank, but now it has been opened up for the other institutions also, and the other private banking institutions have been now opened up, and they have been getting business, and they have been working with the government also. Yes.
Yeah. So,
But yes, the salary part of it has been taken care. Of the government servant salary part is taken care by JNK Bank itself. So,
yeah.
Yeah,
So
sorry.
two questions. Yeah, Saurabh Datta from IDBI Bank. Two questions. This is state-specific initiative that you have taken. Is it different from the Ayushman Bharat initiative?
yes, yes. The
That's number
QR
one.
code
Yeah,
QR code is
okay.
different from the original
So
scheme.
how does the state manage these kind of things? Because number of other states are also trying to get away from this. From the central thing and trying to do on their own, right? So how do you manage the whole thing? And because Ayushman Bharat is also the empaneled hospitals in Ayushman Bharat, under Ayushman Bharat is also for the state also, right? So there is an overlap there. So one, how do you manage that? Second is that from a citizen perspective, what is the capping you have? I mean, it cannot be infinite. The budget cannot be infinite for any hospital or anything, right? So how do you cap it and how do you manage it? That is something that we have to look into.
I'll answer to your both the questions. Point first is that the convergence of various schemes. I mean, as far as JNK was concerned, there was no such schemes implemented prior to the 2016. So this was a good platform for us to go for this new scheme. The very important and advantage of this particular scheme is that this is an central scheme, and it can be utilized all over India. But the state schemes will be implemented only in the particular state. Like supposing you have an scheme in Rajasthan or in Gujarat, the state specific scheme. The beneficiary will have to go to only those hospitals within the state and take the treatment. Whereas under the Pradhan Mantri Jana Arogya Yojana scheme, this has been opened for all the hospitals across the state, which are across the country, which have been empaneled under this scheme. Because
so these two are separate. The Arogya, the Ayushman Bharat and this Jan Arogya is separate or what? Is same?
it is the same. It is the same scheme. Okay. It is the same scheme. But then individual states has to implement it in their own
Correct.
thing. But what I'm trying to mention here is that if any citizen or any resident of one particular state, he has got a card under the Ayushman Bharat scheme, he goes out of particular state. Exactly. Supposing he goes from Delhi to Maharashtra and he feels sick or he feels ill and he won't need to be given medical treatment. He would have spent his own money in that particular state, take the treatment, and then come back, and then he'll have to reimburse from his own thing. Under this scheme, the the biggest advantage is that if he has that card, he can go to any empanel hospital in that particular state and directly take the treatment. You don't have to spend a single pie on that thing. And that particular hospital will definitely will raise the claim to the parent state. That is the biggest advantage of this scheme. The second part was what you said.
Yeah, the second part is that, for example, you have a capping, right? So you have the
Yes.
government hospital. So there are two parts to it. One is that you have government hospitals who can definitely provide these facility under those, anybody having the
Right.
Ayushman Bharat or maybe the state people who are there, they will be availing those facilities. One. Then second is that also the private hospitals have got certain portion which is given to these schemes, right? So the private hospital has to also have to cater for the central cream under the government of India, right? But they have certain cappings for certain treatments and all of that. So how these two matter, and one is that there has to be some kind of a financial limit after which you cannot exceed.
Yeah, exactly. I mentioned in the earlier saying that these schemes provide 5 lakhs rupees insurance cover for each family per annum. So whichever family or wants to take any treatment at any empanel hospital, he can go and take the treatment free of cost, and up to 5 lakhs. And these 5 lakhs been every year it has been again reloaded to the wallet of the beneficiary. Now, as far as the packages are concerned, the package has been already approved by the National Health Authority at the national level. And once we empanel the hospital, we sign an agreement with them and we provide with them the rates for each particular treatment. So there is no confusion at all. So if they know, like supposing if somebody wants to have a bypass surgery in particular hospital, that it will be 85,000 or 1 lakh rupees, whatever it is. So it's uniform in everywhere. And that amount they'll get it immediately after they submit the claim on that thing. So that's an advantage of the scheme. In some of the states, there are these 5 lakhs amount has been they have increased to 7 lakhs, but this is only state specific. But this is across the India, so anybody can go and avail the benefit. Yes, please.
So you were talking about the digital transformation on the platform end.
Yes.
Transparency and compliance part will be carried on from the backend perspective.
Yes.
My concern is why the customers are given card, why they can't be given a QR code or a application where they can track, they can see anything as such. As of now, it is there.
We are working on that lines, but as of now, what we wanted that since the implementation of the scheme has to be accurate on the ground, because we need to know who are our beneficiaries. So there has to be some sort of an authentic data with us. So what we have done is that we have taken the NAFSA data, that is National Food Security Act data, which is a ration card of the family, because the scheme is for the family, it's not for the individual person. So we need to know like who are the family, like husband, wife, children, father, mother, whoever is there, and that has been linked to the Aadhaar card. So we know and we get to know how many people are there in one particular family, and then accordingly the insurance coverage is provided to the family. So, but yes, maybe
based on what you are telling, QR code is there, based on which they are giving the feedback. Why can't you devise an application or a platform where the customer can see what exactly is the amount which has been deducted? What are the other transparencies which a customer can see?
Right. In fact, we are working on that thing, because what has happened is that now this platform is there only with the hospitals and the department. The public are not coming into that things. They are only got to know what is the amount they are available with. Like once at the start of the year, 5 lakhs have been credited to their wallet. Once they take a treatment, they don't have any connect with the system and they don't know what is happening, how much is the money with them. The next time when you go to the hospital, then they will come to know what is the balance available. So we are working on that thing so that people also have an interface with the scheme, so that they know like what is the treatments and what is the...
I think based on a similar background, e-RUPI was done.
That is part of it. That is a part
COVID,
of it.
for
that,
COVID.
It is in fact a part of it, in a sense that some of the hospitals didn't have the facilities, in-house facilities for diagnostic. So they were supposed to have a tie-up with the third party, with the diagnostic centers, and the patient are required to pay there directly. So what we have done is that we have introduced this e-RUPI, so that the hospital will raise that e-RUPI challan on the portal itself, and that will go directly to the diagnostic center. the citizen is not required to pay any money in between that things. But at present, that is happening that they have, in case they have to require to go to the any diagnostic center, then they need to pay the money there and get the reports, which will be then be examined by the doctor, and further treatments are being given to them. So, but yes, we are working on that things. ERUP is now been implemented in almost on pilot basis around 15 to 20 hospitals. So we are working on that.
In the issue was that they don't have a QR code scanner, any of the hospitals, even in the metro cities also. So even if you are giving the amount to the citizens of India, they won't be able to. They are not able to actually use it.
QR code?
Yeah.
It's available in all the hospitals.
Majority of the hospital, it was not there. We have done a pilot. I am from Union Bank of India and I have done a pilot. So in Mumbai itself, even in our location, there was not even a single hospital.
No, because this is an initiative of the state of JNK.
JNK, okay.
Yes, we have introduced that things. Okay, it's not been available in the other parts of country.
For COVID, I think we have done it. It was there. 700 rupees was given to the citizens, but they were not able to use it.
Acha, okay. I mean, I'm not aware of that.
Yeah,
But this is totally free of cost. Nothing to be done. No charges have been made to the citizen. So that's the scheme what we have done. So I thank you all of you.